we decided to compare infections in relapsed refractory multiple myeloma patients who received BCMA-directed CAR T-cell therapy with CD19-directed CAR T-cell therapy in patients with large B-cell lymphoma, including all histologies. This was, in terms of methodology, this was a single-center retrospective analysis, and we wanted to see if there are large differences in terms of infection burden, infection density, patterns of infection, and non-relapse mortality. The primary endpoint of the study was non-relapse mortality, and secondary endpoints of the study included infection density, infection patterns, and the overall duration of infection, trying to see how long after CAR T-cell infusion does the main risk of infection remain. Our main findings were that non-relapse mortality was higher in CD19 CAR T-cell recipients as compared to BCMA CAR T recipients, although the results were not statistically significant. The second finding was that there was a clinically meaningful and a statistically significant difference in the events per 100 days, infection events per 100 days, as we went out from CAR T-cell infusion. So it was the highest in the first 30 days. From day 30 to day 100, it went considerably low, and then so on beyond until 6 months, and then beyond 6 months. And that there was a sizable and a statistically significant decrement in the incidence of infections as we moved farther out from CAR T-cell infusion. And the third takeaway from this study was primarily the fact that CRS was identified as an independent driver of infection in both the subgroups in multivariable analysis, corroborating the existing data.